there, Marina. So President Obama has urged the public not to panic over Zika, but also insists that the United States needs to be prepared and to quickly respond to local transmission of the virus just in case. What would that $1.8 billion be used for?
Well, Manila, if Congress approves the funding, a good portion of the money would be allocated to mosquito control programs. While there has been cases of Zika transmission through sex, blood, and saliva, the primary way of getting infected is through a bite from the Aedes mosquito carrying the virus. Now, those particular species of mosquitoes, the Aedes aegypti mosquito, they're common here in Florida as well as along the Gulf Coast and states that border Texas. The emergency funding would also be used to develop diagnostic tests, improve support for low-income pregnant women, and arguably the most important thing the money would be used for would be to speed up development of a vaccine. Remember, there is no vaccine for Zika or medication to treat the virus. And this issue has ignited global concern due to the link between pregnant women being infected with Zika and then their babies being born with microcephaly, a disease that causes unusually small heads and underdeveloped brains in infants. Now, Brazil has reported more than 4,000 cases of microcephaly. According to the Center for Disease Control and Prevention, there's been at least 50 laboratory-confirmed cases among U.S. travelers since December. Last week, Dallas confirmed the first case of local transmission in the U.S., which health officials say occurred through sex, not a mosquito bite. Now, as spring and summer approaches, so does mosquito season, and that's why it's especially important to get the ball rolling when it comes to being prepared in the event there is a case of transmissions through states or an outbreak in the U.S.
Now, you just mentioned Brazil, which is, of course, ground zero for this current Zika outbreak. That country is, of course, hosting the Olympic Games in August. It's hot, mosquito season, right? The officials claim that by then the virus won't be a health threat. However, the U.S. Olympic Committee isn't really saying or giving the same assurances, right?
That's right. The United States Olympic Committee has told the American Sports Federation that athletes who are worried about Zika should skip the games in Rio and not head there if they don't feel comfortable going. According to Reuters, the USOC held a conference call in late January to inform sports federations about possible hazards associated with attending the Brazil Olympics. Now, the committee reportedly underscored that pregnant women or those thinking about getting pregnant should not attend the Rio Games. Brazil is just one of dozens of countries or territories with reported cases of Zika transmission. Most outbreaks are in the Americas. Now, last week, the World Health Organization declared the virus a public health emergency. But in the meantime, Brazilian organizers have reiterated that they have no intention of canceling the Rio de Janeiro Olympics because of Zika.
Wow, that is some crazy things to think about, that a mosquito might actually stop the Olympic Games. Thank you so much for that, Marina. That was RT correspondent Marina Portnaya reporting from our Miami studio.